Hi, I'm Dr. Triveni Arun, consultant obstetrician gynecologist from Birthright Rainbow Children's Hospital, Hebbal, Bangalore. So today I'll be talking about gestational diabetes. What is gestational diabetes? It is a high blood sugar where a woman develops in pregnancy, and this is common. We come across in day-to-day practice. Out of 100 women, 4 to 5 women are known to develop gestational diabetes. So this is mainly developed because of decreased production of insulin in the body, because there is extra need, there is a more demand in pregnancy to produce more insulin, because lack of insulin production and also the insulin resistance, where the insulin will not metabolize the amount of glucose produced in the body, because of which there is high blood sugar levels in the body, which causes gestational diabetes. Now there are certain risk factors where a woman can develop gestational diabetes. First thing is, if a woman is having high BMI, that is their height weight ratio of more than 30, and if they have had any previous pregnancies with gestational diabetes, and if they have given birth for a good weight baby, that is more than 4.5 kgs, then if they are having a family history, if the parents are diabetic, siblings, brothers, sisters are having diabetes, can increase the risk of gestational diabetes. And we being South Asians, we are ethnically more prone to develop diabetes as such. So these are all the risk factors where a woman can develop gestational diabetes. Now, what are the effects on the mother and the baby of this gestational diabetes? For the mother, usually there are no symptoms which are shown, but commonly when they go on home glucose monitoring regularly, which shows increased blood sugar levels, which can affect the growth of the baby. On the baby, the effects are the baby can grow a little on the bigger side, and there are sometimes there can be more water level around the baby, which can lead to an early delivery. Then sometimes, rarely, there can be a stillbirth if the blood sugar levels are not very well controlled. And after the delivery, the baby can have low sugars, they can develop jaundice, sometimes there can be a respiratory problems at birth. These are the effects on the baby. And what are the effects on the mother? Because of the uncontrolled blood sugar levels and increased water level around the baby, there are chances of early delivery, and also there are high chances of going for induction of labor, and also the mother going into a cesarean section. These rates are higher in a mother with gestational diabetes. And now, how to diagnose this gestational diabetes? There are certain screening tests which we do for all the women. If regularly it is done in the booking test, all the blood sugar levels will be done, and routine screening will be done between 24 to 28 weeks of pregnancy. And if the woman is having a risk factors, then we do it. The screening test will be little more specialized in the early part of the pregnancy. So there is 2 ways to do the tests. One is one-step test, other one is 2-step screening test. One-step test is giving a glucose, which is called as a glucose challenge test, where we'll give 50 grams of glucose. Then it is a random test any time of the day you can do. After taking 50 grams of glucose, then 1 hour later, they will take the samples. If the levels are abnormal, we'll be telling you to do a detailed sugar test, that is the GTT test, where you will be asked to come in a fasting state, 8 to 10 hours of fasting. Then after taking the fasting sample, we'll give a glucose. Post that 1 and 2 hours later, we will take the blood samples. If anything is abnormal, we will be advising you accordingly. This is a 2-step screening. One-step screening is where we will do a fasting sample, then give 75 grams of glucose, then take the sample at 2 hours later. Then if the levels are abnormal, we will be advising you how to go about further. So now, how to handle this if the blood sugar levels are abnormal? If the blood sugar levels are abnormal, we will be telling you to go on regular exercises, healthy eating, monitoring your blood sugars at home with the glucometer. Then if the values are abnormal, we will put you across a specialist doctor like an endocrinologist, where they will start you on tablets or an insulin. And if it is well controlled, you are going to have a healthy ongoing pregnancy and also a healthy baby. So it is better to go on a regular healthy diet, eat healthy, regular exercises, which will help you to have a healthy pregnancy. Thank you.